Howdy everybody, Dr. Islam here, coming in today for your live Poop Tip Tuesday. I want to thank you guys for joining me today. So we have a great show on my live stream today. We're going to talk about a couple different things. Number one, why is mucus in your stool? Number two, what is the difference between indigestion and heartburn? A lot of people confuse the two symptoms and they think that it may be the same thing when actually it may not be the same thing. Number three, why does restaurant food or fast food cause diarrhea? Is a great question I got on one of my DMs. Number four, why does your stomach make a lot of noise and what we can do for that? And number five, why do some women get what are called period poops? What is going on there? What can we do to get that taken care of for you? So guys, I want to thank you for watching me today. So like every Tuesday, I want to hear two things for you. Number one, are you watching this live or on the replay? And also number two, let me know when you're watching this from. I would love to hear your comments down below. And I thank you guys for watching on today's video. Carol, it's good seeing you. MJ, it's good seeing you. Taz, good seeing you as well. Jim, always good seeing you as well. Amanda, great seeing you. And B, great seeing you on the live stream. Guys, thank you for watching. And if you guys haven't seen me before, my name is Dr. Islam, and yes, I'm an actual poop doctor. My passion is to give you, yes, you, best tips and tricks to help out with your health. If you haven't already, a couple things, smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter. I have great tips, great tricks. We can get the best of what is going on. I want to thank you guys for watching on today's live stream. Let's begin. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, so let us talk about mucus. Okay, I get this question a lot from a lot of people about, is mucus in your stool normal? Is it abnormal? What can be going on? So mucus in and of itself is not a bad thing. Your colon does not have a cold. It's not sick. It's not a big deal. But mucus can sometimes be a sign of a normal colon, or it can be a sign of something else going on. It's hard for us to know. We have to kind of add these things to different symptoms you may be having. So for a lot of people who have mucus in their stool, this could be a normal sign of what's called irritable bowel syndrome or IBS. Your colon lining sheds almost all the time. And when that colon lining sheds, it may actually be secreted as mucus. This is very normal for a lot of people. And for some people who have more diarrhea or IBS-D, irritable bowel syndrome with diarrhea, that constant diarrhea can cause more and more shedding to occur. However, there are other individuals in which mucus in the stool can also be a sign of colitis inside that colon. Now that typically will present with a lot of different symptoms: weight loss, pain, bloody diarrhea. And this can be typically examined with the colonoscopy to see if that's the case or not. But for the vast majority of people, mucus in the stool is a very normal thing to have. And for the vast majority of people, it does not mean anything worrisome. Now, however, if you are having mucus in your stool, make sure you let us know, because there may be other questions, other things that we want to do to find exactly what is the reason why you may be having mucus in the stool, and that may be something that we want to investigate further, or we want to maybe at least reassure you that nothing worrisome is coming from that. All right, so second question I got from a patient, actually from somebody who sent me a DM, who said, hey Dr. Islam, what is the difference between heartburn and indigestion? So let me know in the comments down below if you've wondered this. Are you wondering, is this actually heartburn or is it indigestion? And what is the big deal about the differences between the two? So let's go into this in detail. So what exactly is heartburn? It is literally what it sounds like. It is burning in your chest, or burning in your esophagus, burning in your in where your heart is at. And this typically is due to a valve between the esophagus and the stomach being open longer and more often. And because it's open longer, that acid will go up into the esophagus to cause that burning, to cause that chest pain, to cause that heartburn symptom that's there. It's not a problem of too much acid. It's not a problem of too little acid. It mainly is a problem with that valve between the esophagus and the stomach. That is heartburn. It's literally literal burning going inside your esophagus. Now, what is indigestion? Almost the same, but very different. So the medical term for indigestion is called dyspepsia, and that is the medical term for indigestion. What this basically is, this is more of pain in your stomach. It actually hurts inside your belly. It can hurt kind of right here. You don't feel that burning necessarily, though you may have acid reflux. You may not feel that burning when you have indigestion, but you feel pain, upset stomach, queasiness, don't feel very, very good afterwards. Now, this can be due to a number of different reasons. For some people, it actually may be an acid problem. There may be either an imbalance of your acid, or maybe you just have a problem with the protective mechanisms of your stomach. Number two is that there's certain medications that can make it more likely for you to have indigestion, whether it's anti-inflammatory medications. So things like Aleve, naproxen, Advil, Motrin, things like that. Number three is that you actually may be on a blood thinner that can decrease the lining of your stomach. Number four is that you actually may have an ulcer. An ulcer can present as indigestion or dyspepsia as well. Number five, you actually may have an infection called H. pylori, very common reason to have indigestion and pain in your belly. And then lastly, it may be a problem with how sensitive your stomach is. If you've heard of fibromyalgia, you can also have fibromyalgia of the gut. And this is what indigestion can sometimes be for some people. So how do we treat both things? So for heartburn, obviously, lifestyle changes do matter. If you avoid certain foods, if you make sure you don't eat late at night, if you make sure you have small, frequent meals throughout the day, if you lose weight, that will help out with the burning going in the esophagus. But for some people, you may have to be on an acid medication, which can help control some of those symptoms that are there. Let me know in the comments down below if you ever experienced that or if you try that as well. Indigestion can be due to a lot of different reasons, and because of that, the treatment is not as clear cut. For some people, giving them acid medications will help out. For some people, treating their H. pylori will get rid of it. For other people, sometimes trying to change the muscle fibers of the stomach, getting that affected, may help out with indigestion. And for others, maybe it's dietary changes as well. It is hard for us to know the direct answer when it comes to indigestion. So it really kind of depends what we think the problem is. For both options, we have different therapies for them. And for both options, we have different workup to see if this may be a potential cause for their issues. I'd love to hear your comments down below about what your experience has been with when it comes to indigestion and heartburn and other issues just like that. And Taz, you're exactly right. H. pylori is a very common cause of indigestion. It sucks. It's not fun. And this can be a very troublesome entity for us to fix, mainly because H. pylori is a bacterial infection that, if it's left untreated, has a chance of developing worsening gastritis, worsening ulcers, and has a chance of developing into stomach cancer or stomach lymphoma. And so we typically have to eradicate that H. pylori with a course of antibiotics that you take for a couple of weeks. And then sometimes we have to do what's called a breath test or a stool test to confirm that the H. pylori is gone. And it's very important for us to do this because if that H. pylori is still inside your stomach, it has a chance to cause worsening inflammation, and it has that chance to progress into cancer in the future. All right. So let's answer. So good question. So Taz answered this question. Can PPI cause more heartburn and indigestion? So it's a very good question. So I'll tell you this. If you have heartburn, typically it should get better with an acid medication. If you have indigestion, it may or may not get better. And so this brings into mind, in my opinion, is heartburn or indigestion the real cause of your symptoms? Because an acid medication should not make it worse. Now, if it does, this brings to my mind, all right, something else may be going on. Maybe you have a overgrowth of some bad bacteria that's causing your stomach pain. Maybe you have a very sensitive stomach, and that's what the issue is. And so we may have to address that. Maybe you have something else going on that could be causing your symptoms to get worse. Maybe we may need to take a look with an endoscopy, or we may have to do other testing to see actually if it is a problem with that valve inside that esophagus or not. And so there are different testing that we have to do to see if that is the case. And so I would say typically though, And for most individuals, this may not be, these acid medications typically make things a little bit better. All right, great question. All right, question number 3. I got this on a DM. Dr. Islam, why does restaurant food or fast food cause diarrhea? Let me know in the comments down below. I've experienced this for sure. Let me know in the comments down below if you've experienced this, or you know somebody who has experienced this as well. And so there are a lot of different reasons why fast food can really give you fast bowels. Oh, I just thought of that. Great joke by me. I'm going to give myself a thumbs up. All right. Well, number 1, keep in mind what you're eating, okay? When you're eating fast food, it is not the healthiest food that's there. It's food full of oils, food full of grease, food full of really difficult ingredients to digest. Number 2 is that there is a lot of fat in these fast foods, and that fat for some people can allow things to cause more frequent bowel movements, also to cause diarrhea as well. Number 3 is that keep in mind, a lot of people don't realize this, but they actually may be allergic to a lot of the ingredients in the fast food, whether it's ketchup, because ketchup has high fructose corn syrup. A lot of people can have an allergy to that. Maybe it's cheese in that cheeseburger or that taco. You may be lactose intolerant. Or maybe sometimes the bread that you would have the fast food in, whether it's tacos or whether it's hamburger breads, whether it's a sandwich. Sometimes some people can have an intolerance to wheat or gluten as well. And then lastly, sometimes it's the way those fast foods are made. I can almost guarantee you they are not doing this in a way that may be the healthiest thing for you. They may be using oils that are not good for you. They may be using substances that are not good for your health, and that can cause gut issues to get a lot worse as well. It's a very common problem. A lot of people have this, and so obviously one solution, pretty easy, don't eat fast food. Oh, thank you, Captain Obvious. But I know this is easier said than done. But I will tell you, for my patients who eliminate fast food, who get rid of it, who can change their gut habits, they tend to feel a lot better as well. All right, perfect. All right. Question number 4. Dr. Islam, I need help with stomach noise tips. So let me know in the comments down below if you've ever experienced this, where you're in a meeting and all of a sudden your stomach just starts to rumble and you don't know why, or you're in bed and then your partner, their stomach rumbles as well. What is going on? What is the deal? Well, stomach rumbling and stomach movement is very common. It's a scientific term called boroborygmi, and that is an actual medical term. This is the process of your stomach contracting and moving things through the small intestine, and this is a very normal phenomenon. So whenever you are not eating, one of the things that your stomach does helps to sweep things through from your stomach into your small intestine, and your small intestine does the exact same thing as well. And for some people, that can be very noisy, sometimes because there's a big pocket of air that's there. Sometimes you have a lot of things that need to be moved through as well. And for some people, it could be a sign that you're actually hungry. Yes, if you're hungry, you're going to make a lot of noise, and that's going to make things more loud for you and your partner, and also in a meeting. So how do we fix this? So number 1, I will tell you, it really is not a big deal. It's very common to have. People understand this, so we're not stressed out too much about this. Number 2, try to drink some water. Water will satiate that stomach. It'll make you less hungry. It'll put something inside that stomach so you don't make as much noise, and it can move things through. Number 3, have some food. If you're hungry and it's making noise, that's the obvious solution. Have some food and see if it'll help out. Number 4, if you feel like you're having a lot of gas and distension, try an over-the-counter simethicone or Beano. They work fantastic, and it really helps out with that as well. And number 5, sometimes if we may need to check to see if there's some abnormal bacteria inside your gut. There could be a change in your gut microbiome that needs to be adjusted. And then lastly, there are certain food things I would try to eliminate. Things like high fructose corn syrup, dairy products, sugarless gums, diet sodas, carbonated drinks. These are easy fixes that can help out with the sound, and also help out with some of the contents that can occur inside your gut to make bloating a lot worse as well. So very normal to have, but they're simple, easy fixes to get this taken care of. All right. Perfect. All right. Last question. Dr. Islam, why do some women get diarrhea or constipation during their period? All right, so I asked some friends of mine if they had any poop questions, and this by far was the most common question that I got. Period poops. What is going on? Why do people have it? And what can we do to help get this taken care of? So this is actually a very common problem that a lot of women have, that during their menstrual cycle, they either go crazy with their bowel habits. They either fluctuate to constipation or fluctuate to diarrhea, or everything just goes kind of out of whack. What is going on here? So we don't quite know exactly what the cause of this is, but we think it may be a hormone-like substance called prostaglandins. Now, prostaglandins get secreted within your uterus to help shed that lining whenever you're going through your menstrual period. But in addition to that, those prostaglandins can affect the muscles of your gut. Yes, your gut. So if you have too many prostaglandins, it can contract your gut so much that you actually get loose stools and diarrhea. In addition to that, prostaglandins can make it less likely for your food to be absorbed, causing more diarrhea as well, and also causing people to have bloating as well. But for other people, you actually may have less amount of prostaglandins, and those less amount of prostaglandins can cause you to have constipation, and that in turn can cause bloating and reflux and gut issues as well. So it's a very common problem that people have when it comes to period poops. All right, now that we know the problem, what can we do to fix this? So my top thing by far that I recommend is to add prebiotic food into your diet, especially if you know that your gut's going to go out of whack when you're having your menstrual cycle. So prebiotic foods work great. Things like wheat dextrin, guar gum. These things are very effective prebiotic fibers that actually can help change your gut microbiome, make it easier to digest. Number 2, consider adding a probiotic as well. Now, probiotics don't work for everyone. I am personally of the opinion, based on the evidence, that it's more myth with a sprinkle of medical science, but there is some evidence for some people that probiotics can help out, so you may want to consider taking that. Number 3, I mentioned this before, try to eliminate dairy. Dairy for a lot of people can cause gut issues, and for a lot of people, they don't realize that they're lactose intolerant. So trying to minimize or get rid of dairy may actually help you in terms of helping out with your period poops. And number 4, try to find ways to de-stress yourself. And I will tell you, there is a connection between the brain and the gut. And so for some people, doing things like exercise, meditation, yoga can help out what's going on with the cramping, but also help out what's going on inside your gut as well. And then lastly, consider using over-the-counter treatment. Typically, they're very safe, especially if you can use it if you have a predictable time when you need to use it, whether it's over-the-counter Imodium for diarrhea, or over-the-counter Pepto-Bismol for gut pain, or maybe it's over-the-counter laxatives like Miralax, or over-the-counter stool softeners. These are things that are very safe, very effective, and if you need to use them long term whenever you're going to have your period, that is perfectly fine. Try and do that. But if you can try to implement more of a dietary approach, which is my recommendation always for patients, that may be helpful as well. And sometimes adding some magnesium if you're constipated can help out with the crampiness, but also help you to have more effective bowel habits. All right, guys. I want to thank you for watching. A couple things. Number 1, don't forget to smash that like button, like, share, and subscribe. And number 2, don't forget to subscribe to a weekly newsletter. And if you have a question for me, send me a DM, send me a message. I'd love to hear what you guys have to say. I want to thank you for watching. Hope you guys have a happy and healthy day. Take care, everyone. Thanks, guys.